Well, the Affinity program really is something that offers members of the BC Care Providers Association to use the benefit of group purchasing. So, as a sector, we purchase a lot of goods, things like health benefits and insurance. And when we were able to pool those purchases together, we're actually able to get a lower cost for our membership. So, Affinity, it will essentially become an opportunity for you as a member of BC Care to lower your costs as a care provider and to have a good opportunity to purchase goods and services at a lower cost than you would if you were just buying it as an individual care home. That is essentially the Affinity program. So members will actually benefit from the program in a number of ways. One, financially, they'll be able to purchase products like property insurance, liability insurance, also things like health benefits for their employees. They'll be able to get access to that at a lower cost than they might otherwise if they were purchasing the product individually. In addition to that, we're looking at for the Affinity program the opportunity to have preferred suppliers. So we're able to ask suppliers to come back and tell us if they can sharpen their pencils and provide products and services for our members at a better rate. So all that will stand to benefit members of the BC Care Providers Association. Well, the concept of Affinity program is actually not very unique. In fact, BC Care Providers Association is kind of coming into it a little bit late in the game. If you look at things like Aeroplan and Visa and MasterCard, a lot of them have Affinity programs. So you become a member or you purchase or you are affiliated with an organization and you get a better pricing for something. But it's actually quite common in industry associations to have an Affinity type program. So oftentimes you may get discounted pricing on cell phones or travel or other goods and services. So we've looked at other associations and we've looked at the fact that they've been able to pull together a program that's been able to not only save money for their members, but also been able to provide additional value and to be able to reduce their costs of actually being a member by essence through the Affinity program. I think the Affinity program is very important for the association for a couple of reasons. Firstly, the Affinity program will bring in additional dollars to the association, and what that will be in turn used for is for additional advocacy on the part of members across the province. We'll be able to hopefully increase our capacity for things like communications and for policy and research. So there will be additional resources brought into BC Care Providers to provide additional capacity. So secondly, why it's important for the association is also that, you know, by having an Affinity program, we can actually essentially reduce the cost of becoming a member of the association. And we've heard from a number of care providers across the province that the cost of becoming a member is prohibitive for them and they simply can't afford to do so. But by becoming a member of BC Care and being able to have access to lower costs for things like insurance or things like health benefits, it'll actually help pay for itself. So by being a member, you will be able to benefit and save dollars in a number of different purchase areas that you wouldn't have before. So I think that's one of the big benefits. When it comes to the Affinity program, clearly the biggest beneficiary will be our members. Our members will have access to a number of preferred suppliers. They will have access to a range of products and services. Over the long term, we're going to start out with the insurance side and with benefits, employee benefits, and then we'll look as we develop that to expand that into the years to come. So the biggest beneficiary of all of this will be our members, both through their direct lowering costs of purchases and also by strengthening the association by increasing its revenue base. It'll mean that we'll be able to do more training, more workshops, more advocacy, more policy research on behalf of the whole continuing care sector. So it's a win-win for everyone.